Hello, my name is Stephen Lightfoot and I'm the Chair of NHS Sussex. And what I'd like to do today is to give you a very brief summary of our board meeting held in public that was held on the 27th of November over in Billingshurst. Now, before the board meeting started, we took the opportunity as a board to review our annual Equality, Diversity and Inclusion objective. And this year it's to provide allyship and visible support for the See Me First campaign, which was put forward by our ethnically diverse staff network. This is a really important objective for the board, and I'm really proud today to be wearing my lanyard in support of that particular campaign. Now, the board meeting itself started as we usually do with our Chief Executive's report from Adam Doyle. And we're really pleased to hear about the new ways of working and how they're becoming established with our new organisational structure. And also the launch of our Commissioning for Improving Lives Together organisational development programme. Adam went on to describe the way the government is developing the new 10-year health plan, and also some changes to the NHS England operating model. And so the board quite rightly asked for Adam to provide a report in the new year in terms of what impact that would have on NHS Sussex. Adam's report also went into a series of other achievements, and they include things like our new musculoskeletal service and urgent dental services as well. But if you get the chance, I'd highly recommend you to take the opportunity to read Adam's report just to see the wide range of things that are happening in our system. The board was then joined by the chief executives of our major acute hospital trusts to talk about planned care and how we can reduce the waiting lists for people waiting for operations within the NHS. Now again, like other systems, we have a waiting list that is too long. But actually what the system has come together to do is to provide a comprehensive plan to genuinely bring down that waiting list so that no one has to wait for more than 65 weeks. And the target is to achieve that goal by the end of March. There's a high confidence in delivering that plan, and the board was very pleased to be able to approve it. We then talked about winter and the winter plan, obviously very appropriate at this time of year. And again, importantly, to learn lessons from previous winters. And what I'm really pleased about this time is that we're going to be identifying patients proactively who are most at risk of needing our healthcare services during the challenging winter months. The vaccination programme is a really important part of that plan, and also how we can improve access to same-day emergency or urgent care. And then at the other end of the treatment scale is how we can then improve discharge so we can get people home more quickly after they've had their spell of treatment in an individual hospital. We went on to then talk about our committee reports, and in particular the one I'd like to highlight today is from our People and Digital Committee, because that committee commissioned a survey of NHS Sussex among our system partners, among our leadership team, and also our wider staff group. And what was really encouraging is there was a lot of similarity between some of the themes that were coming back about what we're doing well and what we could improve on. So again, really pleased to hear that there was a strong support for the senior leadership of NHS Sussex, a very clear strategic vision, and a real commitment and loyalty of our staff. But areas still to improve on: we need to reduce complexity, we need to get better at prioritising the things that are really important, and also how we can empower our staff to be able to do more, because in many ways they're the best qualified to do the work that is required. We then looked at our integrated performance report, and that's a really useful report because it brings all of the performance metrics, and there's many of them, into one place. And again, it's always important to keep a balance here, because there are many areas within our system that we're performing really well, not just against our targets, but against other systems. And this report also went into the detail of the actions that are going to be taken for those areas that are either off plan or alternatively are not performing as well as other systems. So we've got this mentality of continuous improvement, and that really came through that particular report. And then I think really in terms of the main set piece for the long-term strategic improvement priorities on our board, we talked about delivering our strategy, improving lives together. And what this team have been doing recently is developing a population health need analysis for the next 10 years. Because we know that we've got an ageing population, we know there's going to be more demand on our services, and we needed to quantify and understand that so we can develop services around that. I think we also heard more about the development of our 13 integrated community teams and how we're redesigning our out-of-hospital services to be at or closer to home. And it was really helpful when our Chief Medical Officer from the Sussex Partnership NHS Foundation Trust joined us to talk about how that particular trust is aligning our community mental health services to that particular model of 13 integrated community teams. I think we then discussed the challenges around some of our hospital services at coping with this future demand. We looked at then the strategic commissioning framework that will be required to review service changes, and also looked at the board assurance framework to think about the strategic risks that would potentially get in the way of being able to deliver that strategy. So again, it was a really comprehensive conversation. And then in terms of next steps, what was really vitally important is our clinical leaders across our system are going to come together to prioritise the areas of improvement. It's really vital that we listen to the areas of improvement determined by the clinicians. They're the people who know best in this particular situation. And also our Chief Medical Officer committed to bring a paper to our next board meeting on cardiovascular disease prevention. Again, thinking about the long-term health of our population. So that gives you a quick summary of the main points that were discussed during our board meeting. And I did take the opportunity before I closed just to thank everybody who's been involved in our system. I think our NHS health and care system is working really well together. It's a challenging environment, but we've got some very clear plans and we're very focused on improving our health and care services for the population that we serve. So thank you very much for your interest, and I hope to see you next time when we meet on the 29th of January for our next board meeting held in public. Thank you and goodbye.